Most people think heart problems only happen to older people, or people who already know they're sick. But the truth is your heart may already be sending you signals, and most of us simply don't know what to look for.
Today, I want to walk you through 7 warning signs that your heart may be struggling. These are things that often appear months before a serious cardiac event.
The first sign is chest pressure. Not sharp pain, most people expect sharp pain, but what many patients describe is more like a tightness, a heaviness sitting right here. This happens because the heart muscle isn't receiving enough blood. The vessels are narrowing, and your body is telling you something is wrong. The second sign is shortness of breath. Now, this one is tricky because most people blame it on being out of shape, or allergies, or stress.
But when the heart isn't pumping efficiently, fluid can begin to build up around the lungs. Even walking up a flight of stairs becomes harder than it should be. Third sign, unusual fatigue, not normal tiredness. I'm talking about a fatigue that feels deeper than sleep can fix. You wake up exhausted, you feel drained even after resting.
When the heart is working harder to compensate, the rest of your body receives less oxygen. Your muscles feel weak, your brain feels slow. That's not stress, that's your heart struggling. The fourth warning sign is dizziness, particularly when you stand up quickly, or when you feel lightheaded for no obvious reason.
This can indicate that your heart isn't maintaining adequate blood pressure. Sometimes it's a rhythm issue, a small arrhythmia that most people simply write off as nothing.
Fifth sign, swollen feet or ankles. This one surprises people. They think it's from standing too long or the heat. But chronic swelling is a classic sign of cardiac congestion. When the right side of the heart isn't pumping efficiently, blood pools in the veins, fluid leaks into the surrounding tissue, and you see that puffiness, especially by end of day. The sixth sign is palpitations, that feeling of your heart fluttering, racing, or skipping a beat. Most people feel it occasionally, but frequent episodes are something to take seriously. Palpitations can be benign, but they can also signal atrial fibrillation or other arrhythmias that significantly increase your stroke risk. Don't ignore them, especially if they happen regularly.
And the seventh sign is one that surprises almost everyone. Pain in the jaw, the left arm, or the upper back, with no obvious cause. This is called referred pain. The cardiac nerves share pathways with nerves in the arm and jaw. So the brain gets confused, it feels pain in the wrong place.
So let's quickly recap. Chest pressure, shortness of breath, unusual fatigue, dizziness, swollen feet, palpitations, and unexplained jaw, arm, or back pain.
If you're experiencing any of these, please don't wait. See your physician. Get a proper cardiac evaluation. Early detection is genuinely life-saving.